So today we'll see beginning of modern pharmacology. The rise or the modern pharmacology beginning, it has two components, or it started with experiment on animals and isolation of active constituent from the plants. So these are some of the plants for an example, and this is an schematic diagram of an animal for the experiment purpose. So we'll take first circulatory system of the dog. The blood circulation system, as we know, it was discovered by William Harvey in 1628. After the circulatory system development or discovery, there was one scientist who took poppy sap and injected into the dog. The syringe was made up of pig bladder, and the needle he used, that was goose quill. So with this system, syringe and needle, he injected first intravenous injection into the dog, and that was Christopher Wren. In 1656, Christopher Wren injected from the poppy plant the poppy sap into the dog vascular system with the help of a syringe made from pig bladder and the needle from the goose quill. He injected poppy sap, as well as he also injected wine directly into the blood of the dog. In 1807, from this opium plant, first time morphine was isolated. Morphine was isolated by the scientist named Sir Turner. This was the first pure form of the drug which was isolated from the opium plant. This morphine, then it was injected into human patient that was suffering with pain, and this injection was subcutaneous injection. So in 1853, Alexander Wood, he developed hypodermic needle, and he injected this pure form of morphine into one human patient subcutaneously. Then this is the Nux vomica, that is the strychnos plant. From the seed of this plant, strychnine poison was isolated. Strychnine poison was isolated by Pelletier. This was isolated, and this strychnine, it was injected into the dog by Magendie. So Magendie studied the effect of IV injection of the strychnine as well as the isolated morphine by injecting intravenously into the dog body. So Magendie studied the effect of strychnine and morphine by injecting intravenously into the body of the dog. And what he found? Magendie found the site of action of the strychnine, that is nothing but the spinal cord of the dog. Spinal cord. After this, there was mushroom named Amanita muscaria. From this, first time Oswald Schmidberg, who is known as father of modern pharmacology, he isolated muscarine. So from the mushroom Amanita muscaria, Oswald Schmidberg isolated one alkaloid named muscarine. He demonstrated, suppose this is the vagus nerve which releases acetylcholine at its terminal on the receptor M2. On the heart, M2 receptors are present. So the vagus nerve releases acetylcholine and it decreases the heart rate. This is the normal physiology of the vagus nerve. What he demonstrated, he stimulated this nerve electrically. He stimulated the vagus nerve electrically and he found that this reduces the heart rate. This is the normal effect. Then he injected muscarine and the muscarine compound had similar result to the electrically stimulated vagus. Means once the muscarine reaches to the M2 receptor, it also leads to decrease in heart rate. So this similarity of these two effects, this was demonstrated by Oswald Schmidberg after isolating this compound alkaloid muscarine. So if we electrically stimulate the vagus nerve, it releases the acetylcholine and acetylcholine work on M2 receptor which leads to reduction of the heart rate. Similarly, this muscarine alkaloid, it reaches to the M2 receptor and reduces the heart rate. So this was demonstrated by the father of modern pharmacology, Oswald Schmidberg. The last plant, that is your foxglove plant, that is nothing but the Digitalis purpurea. In 1783, extract of this foxglove plant, it was reported that this extract can be used to treat dropsy, that is nothing but a form of edema caused by congestive heart failure. So foxglove plant, in 1783, William Withering, he reported the use of the extract from this plant to treat dropsy or edema that is caused by the congestive heart failure. This experiment was conducted or reported by William Withering. Then from the same plant, Claude Bernard studied and he reported that active constituent of this plant is Digitalis, whose site of action is the heart. Site of action is the heart. So this is all about the beginning of modern pharmacology, where some of the scientists, they isolated active molecules from the plant and they demonstrated their site of action and their effect using animals as an experiment. So there are some plants and their active constituents and their experiment on animals. So today we studied opium plant. Number 2, strychnine, that is Strychnos nux vomica. Number 3, foxglove. And number 4, mushroom. The active constituents of these different plants, they were injected into the animals to find out their site of action as well as their mechanism of action. For example, strychnos or strychnine compound was injected to find out its site of action, that is the spinal cord. Then foxglove plant, its site of action, digitalis site of action was found to be heart. Then mushroom, that is obtained active principle was muscarine. And they found muscarine acts similar to the parasympathetic system or vagus nerve, means it decreases the heart rate. Then this opium or the morphine active constituent obtained, this was injected and studied their effect. And this opium, this morphine was also injected to human patient who was suffering from the pain subcutaneously with the help of some hypodermic needles developed by first time Alexander Watt. So this was the beginning of modern pharmacology with some plants and isolation of their active constituent and their injection into the animals to find out the site of action, their mechanism of action.